Chapter 5 begins the process of introducing you to the public health agencies in the United States. So, the outcomes for this chapter are to go over the goals and roles of government public health agencies. You'll see some examples of those agencies. Um, there are 10 essential public health services that we'll go through. We'll also get a sense of the roles of local and state public health agencies, the roles of federal public health agencies, the roles of global public health agencies, how that's all coordinated between those groups, other agencies that are involved in this process, any non-government agencies or organizations involved in public health, and then how the public health field can take the lead in coordinating partnerships. And again, a lot of Chapter 5 is going to sound familiar because of what we're going through with the current COVID-19 situation. So Chapter 5 opens with a few examples of how public health agencies must address a variety of issues. Um, and this is often difficult to determine who's responsible because, as you'll find out from Chapter 5, federal public health is pretty centralized, and most of the responsibilities actually fall to the local level. So, to answer the question, what are government-based public health agencies attempting to accomplish? Number one, preventing epidemics and the spread of disease. That's actually number one. So again, that's what public health is tasked with, and um, you can tell in the United States clearly we've got a little bit of work to do because that prevention of COVID-19 did not go as well here as it did in other countries. Public health is also responsible for protecting against any environmental hazards, preventing injuries, promoting and encouraging healthy behaviors, responding to disasters and assisting with recovery. We see that with Hurricane Katrina a few years ago, and ensuring quality and accessibility of health services. There's three core public health functions that we're going to summarize at the beginning of this chapter. These core functions are not the job of any other group. Number one is assessment, where we collect data for specific groups and define the health problem. Number two is policy development, where we have evidence-based recommendations to guide efforts and positively impact community issues. And the third one is assurance, guaranteeing that public health programs are in place. There are 10 essential functions that are all within those three core public health functions. So we're going to go through each of those. All right, so number one, which is part of the assessment core function, goes through how we monitor health status to identify and solve community-based health problems. Overall, the 10 essential public health services are organized into one of the three core functions. This is a very complex web of local and federal agencies and potentially global organizations when we look at something like what is going on with COVID-19. So again, back to this one. This is part of the assessment core function, and it's important that we accurately diagnose the community's health status, identify any threats to health, and assess health service needs. This includes data collection and analysis. It includes utilization of these statistics that are gathered, and it requires collaboration. Okay, so that's number one of 10. Again, within this core core function of assessment. Number two, this is also part of assessment, and this includes epidemiology. That might be a term you're familiar with based on some of your other courses, which is the study of disease. Determining what are the major health threats. This could include public health laboratories using modern technology to screen and test. This is active disease epidemiology programs and any kind of epidemiological investigation. Again, what's going on with COVID-19 is happening here in number two. And the example of that is the CDC and any state public health laboratories working on how we diagnose COVID-19, how we develop a vaccine, and so forth. This next one, which is number 3 of 10, this now is in the policy development core function. This includes various communication methods, including social marketing. If you've taken health promotion or will take health promotion, we talk about that. Any kind of media communications, making information accessible for all groups, and any kind of joint efforts between schools, churches, any type of community groups. Number 4, this is still part of the second core function of policy development. This includes the facilitation of various groups to address public health issues. This may require collaboration and leadership skills, and we must utilize all of the resources available to maximize results. And this may not necessarily involve groups closely associated with public health. It could be environmental groups, it could be child welfare groups, and I included the example of lead paint as that's not necessarily just a public health issue. This is an environmental issue, it's a child welfare issue. So that's the meaning behind that particular picture. Okay. Number 5 is still part of policy development. This is where we establish public health leadership in communities and continuously improve the initiative. So we constantly evaluate. And this is where we also establish very clear rules like codes or regulations or legislation or laws that guide the public health field. Number 6 now gets into assurance. This is where we make sure policies are enforced and protected. We also ensure quality at this point and review any new interventions as they come on the market, such as drugs or medical devices. Right? Number 7, still part of assurance. This is any type of outreach to enable or any kind of outreach or enabling strategies, especially for anyone who's experienced any kind of a health disparity, which we're going to talk about later on in the class. We need to address any cultural issues such as language or education in this number 7. Okay. Number 8, still talking about assurance. This is where we establish licensure and minimum expectations for the education of public health professionals and facilities. Those of you who've already taken health professions with me, you know better how licensure works at the state levels. Okay. This is also where we talk about continuing educations and efforts to improve the quality of healthcare provided. Number 9, this is the last one in the assurance core function, and this is evaluation. How effective was the program? Did we achieve our goals? Did we improve the health status for the group served? If so, if yes, how? If no, why? Okay. And this last one, number 10, is a combination of all 3 core areas. This is where we connect all of those groups with places like higher education and research to try and implement evidence-based strategies. So this gives you a little bit of a visual of how this all works together and how those core functions and essential services work. Okay. In terms of local and state public agencies and what their responsibilities are, the book clearly states public health is first and foremost a state responsibility. So we talked about the levels of government in previous chapters. The federal government is very loosely involved with public health. State public health agencies have the primary responsibility for all of the things that we've covered. That state agency may be completely autonomous from the federal government. They may also delegate responsibilities to the local agencies or may seek considerable help from the federal level, such as the CDC. Okay, so there's a lot of variation here in terms of how the states manage this. They can get help from the federal government, they can remain autonomous, they can delegate responsibilities to the local level. So there's a lot of different variation here. The 2 most common models are where number 1, either responsibility is delegated to the local level from the state agency, and then the local agency could have some autonomy. Or number 2, the local office is a branch of the state office. So they're the 2 common models in public health at the state level is number 1, responsibility is delegated to the local level from the state level, and then the local agency is autonomous, or the local office is a branch of the state office. Most agencies are somewhat in between these 2 models. Okay, typical responsibilities of a public health agency: immunizations, disease surveillance, disease control, inspection and licensing of restaurants, environmental health, screenings, tobacco control, and any kind of disaster preparedness. Healthcare safety net is offered to those without access to other options for care as well. So we've talked about already in the class where there's gaps in the healthcare system. Sometimes local or state public health agencies will fill in some of those gaps to offer healthcare. Unfortunately, a lot of those have been either reduced or cut, and some of them have been converted to community health centers. Okay. In terms of the role of federal public health agencies. Number one, public health is not a guarantee of US citizenship. Okay? Who is actually responsible? As the slide shows, the Department of Health and Human Services, or HHS. They're the central public health agency of the federal government. In the book, Table 5.2, they provide a summary of the agencies that fall under this. And by far the largest chunk of money is allotted to the National Institutes of Health. They have about a $30 billion budget for research. But for the most part, the federal government delegates a lot of the responsibilities to the states. Now, the one main agency responsible for public health at the federal level is the CDC, which many of you are very familiar with. This is the agency most closely associated with public health at the federal level. This was established in Atlanta in 1946. It started off with a focus on communicable diseases, and this eventually shifted to all diseases. They've had a focus on research throughout this, so they have a very close connection to the National Institutes of Health. And they played an important role in the control and eradication of many diseases, including smallpox and polio. They're playing a key role in the way we're addressing COVID-19 right now. They were unfortunately associated with the Tuskegee study, where Black men were purposely left untreated for syphilis. This is one that is kind of a side topic. But unfortunately, the CDC had a bit of a hit to their reputation because of their involvement in that particular study. But they've added prevention in 1992, and so their reputation has remained fairly high within the last couple of decades. They take on both national and international health issues. Half of their $10 billion budget is actually shifted to the state and local level. So the CDC can play a major role for those local public health agencies that don't have a lot of direction for the state. They have a lot of materials and resources for them. The CDC is looked at as the national leader in public health issues, right? I did mention the National Institutes of Health. This is, again, the primary agency focused on research. It's the world's largest biomedical research enterprise. So a lot of the research coming out, especially in terms of communicable diseases, comes out of the National Institutes of Health. They're heavily involved in training public health staff, and the National Cancer Institute also falls underneath the National Institutes of Health. The Food and Drug Administration, this is also part of Health and Human Services. They're mostly focused on consumer protection, including food safety, but they're also focused on drug efficacy and safety, vaccines, any kind of medical devices, and any public health interventions, right? And then the Agency for Healthcare Research and Quality. This is a research agenda, or they have a research agenda focused on improving outcomes and the quality of healthcare, including patient safety and access to services. SAMHSA, this is a group many coming into this course are not as familiar with. This is a group under HHS that addresses prevention, treatment, and rehabilitation. They also conduct their own research on their topics. They collect data, and they fund local services. The World Health Organization, now we've gone to the global level. Okay, so we see what happens at the state and local level, at the federal level, and now we're talking about at the global level. The World Health Organization was created in 1948. It's steadily increased in prominence due to issues impacting the entire planet. Again, the World Health Organization has been very vocal and has had to take a leadership role in the spread of COVID-19. The World Health Organization is part of the United Nations organizations. It's funded by the World Bank and other institutions, but surprisingly, the funding is very limited. But they do address many issues, including tobacco, disease control, vaccines, and global health disparities. Okay, how we put all of this together comes down to 6 sequential steps of a community-oriented primary care. Okay, so number 1, how's the community defined based on geography, their institutional affiliation, and other common characteristics? Number 2, what are the demographic and health characteristics of the community, and what are its health issues? Number 3, what are the most important public health issues facing a community, and how should they be prioritized based on the data and the perceived need? Number 4, What are the most effective and efficient interventions for addressing the selected health problems based on evidence-based assessment? Number 5, what are the strategies that are going to be utilized? And number 6 comes back to how we're going to evaluate the effectiveness of this. So this just gives you an idea of once we are going to address a health issue, what are the steps that we follow? Okay, and then this gives you a visual representation of the framework of governmental public health agencies. So we already went through this as far as how the responsibilities are delegated down from the federal government all the way to the state level, to the local level, and then all the way back through to the global level. Okay, so that summarizes chapter 5. Let me know if you have any questions or concerned about that information.